Your brain has no sensation of its own. In fact, when they do brain surgery on people, they will anesthetize or put some anesthesia on the scalp. They'll cut away the skin there so that people don't feel anything. They'll use some anesthesia. They'll peel back the skin, and then they'll use let's call it what it is. It's a bone saw, and they basically saw open a little window in the skull. I've actually done this before and seen this before. I've done this many times before. And once you're inside the brain, you can put electrodes in there and you can put various things in there, of course, all for therapeutic purposes. And you do that without any anesthesia to the actual brain tissue because it has no receptors to sense anything. It doesn't have pain receptors. It doesn't have pressure receptors. None of that. When you have a headache and your head feels like there's too much pressure, well, that's because of receptors that lie outside the brain. So your organs are different. They need to tell your brain what's going on. And there are ways that you can control the mechanical and the chemical state of your organs in ways that are very powerful. And this is crucial to do because if you can properly regulate the mechanical and chemical environment of your body, your brain functions better. This is absolutely clear from data that if your gut is healthy, if you get the alkalinity right, the acidity right, and if your spleen is healthy and happy, and if your lungs are working properly, not just breathing and pumping in and out air, but you're breathing at the right cadence for a particular activity, then your brain will function better. So let's talk about how you can adjust the mechanical and chemical environment of your organs in order to make your brain better, and how your brain can make the mechanical and chemical environment within your organs function better.